Welcome, everyone. If you're in nursing, you know that pain is one of the most common and most complex challenges we face every single day. So today, we're going to break down the core principles you need for effective and compassionate care. Let's get started.
Now, everything we're covering is based on the foundational work of Haida Cressa. It's a fantastic, hands-on resource designed for both training and daily practice, and we're going to use its clear, structured approach to really deepen our understanding.
First, let's get our bearings with the official IASAP definition. The really interesting part here is the emphasis on it being a sensory and emotional experience. This reminds us, right from the start, that pain is never just a physical signal. It's a deeply personal and subjective experience for every single patient. Our journey today is broken down into 5 key areas. We'll start with the basics of how pain even happens, then move to assessing it properly, explore the different therapies available, take a look at the bigger picture, and we'll finish up with your crucial role as a pain expert. Okay, let's start with the physiology. Understanding the how and why of pain is the absolute first step to managing it. It's the difference between just treating a symptom and truly understanding what your patient is going through.
The core process is called nociception. Think of it as the body's alarm system. Specialized nerve endings, the nociceptors, detect potentially damaging stimuli, like heat, pressure, or chemical irritants, and they convert that into an electrical signal that gets sent up to the brain.
So why do we feel a sharp pain first and then a dull ache? Well, it's all down to 2 types of nerve fibers. As you can see here, the fast A-delta fibers deliver that immediate sharp warning, while the slower C fibers transmit the lingering, dull, throbbing pain that follows.
Of course, pain isn't always that simple. We often run into complex syndromes. Neuropathic pain, for example, doesn't come from tissue injury, but from damage to the nerves themselves. And phantom pain shows us that the brain can create a pain experience even without a physical source. These all require a specialized approach.
All right, let's move on to assessment, because you can't treat what you don't measure. An accurate, consistent pain assessment is the absolute, non-negotiable foundation for any successful pain management plan.
This brings us to a central challenge. How do you measure something that's completely subjective? While we can't plug in a painometer, we do have validated tools that help us translate the patient's personal experience into a quantifiable value we can track and treat. The most common tool is the Numeric Rating Scale, or NRS. It's simple, it's fast. By asking the patient to rate their pain from 0 to 10, we get a clear baseline and a way to track the effectiveness of our interventions.
For patients who express themselves better with words than numbers, the verbal rating scale is an excellent alternative. It lets them choose descriptive categories like mild, moderate, or severe.
And for an even more nuanced measurement, there's the visual analog scale. Here, the patient marks their pain intensity on a continuous line, which allows for a very sensitive way of capturing changes.
But of course, these scales don't work for everyone. We have to adapt our assessment for patients who can't self-report. With children, fear and parental reactions are huge factors. And with patients with dementia, we basically become detectives, relying on sharp observation of nonverbal cues like facial expressions, body language, and changes in behavior.
Once we have a solid assessment, we can move on to therapy. And modern pain management is never a one-trick pony. It's a multimodal approach that combines medicinal and non-medicinal strategies. From the medication side of things, the World Health Organization's analgesic ladder is the gold standard. This is the globally recognized framework for ensuring that pain medications are used in a logical, stepwise fashion.
It's a simple 3-step process. You start with non-opioids for mild pain. If the pain persists or increases, you move to step 2, adding a weak opioid. For the most severe pain, you escalate to step 3 with strong opioids. And crucially, adjuvant medications can be vital at any step to manage side effects and address specific types of pain.
This table is a great practical resource for those step 2 medications. It gives you a quick overview of common weak opioids, their typical dosages, duration of action, and maximum daily doses. Having this kind of info at your fingertips is key to safe and effective practice.
But we know that a pill isn't always the only answer. In fact, the most effective pain management plans integrate non-medication therapies right alongside pharmacology to treat the whole person.
And this is where nursing can really shine. Interventions like cold applications, helping with a TENS unit, using aromatherapy for relaxation, or guiding patients in distraction techniques are powerful tools that are often initiated and managed by the nursing team and make a huge difference. This leaves us to a broader, more holistic perspective. Especially in chronic illness or end-of-life care, we have to look beyond the physical symptoms and consider the full impact of pain on a person's life. Remember that IASB definition? Pain is sensory and emotional. It affects a person's mood, their ability to interact with family, their work, their entire sense of self. Effective treatment has to address this entire biopsychosocial experience, not just the nerve signals. So let's wrap up by focusing on what this all means for you. In modern healthcare, the nurse is not just a caregiver. You are a pain management expert and a crucial coordinator of the entire treatment team.
Becoming a pain expert means mastering these core competencies, from having deep physiological knowledge and confidently using assessment scales, to educating patients and families and seamlessly coordinating with doctors and therapists. This is the standard of professional excellence we should all be aiming for.
And in the end, that's what it all comes down to. I'll leave you with this final thought. Every accurate assessment you make, every timely intervention you provide, every compassionate conversation you have makes a direct impact. So how are you going to use what we've discussed today to improve your patient's quality of life, starting with your very next shift?